Now that we have looked at a slow sinus rhythm, let's explore our options in dealing with sinus tachycardia, or faster than normal rhythm measuring between 100 and 150 beats per minute. As with sinus bradycardia, the patient's SA node fires electrical impulses that pass through the normal conduction pathway in the atria, AV junction, bundle branches, and ventricles, but in the case of sinus tachycardia, those impulses are firing too fast. Again, the sinus node is functioning properly, but it is not firing at the correct speed. Be aware that if the rate is greater than 150, it is probably not sinus tachycardia, so quickly and carefully evaluate the situation and respond accordingly. Let's examine the ECG characteristics for sinus tachycardia. It follows all of the criteria for normal sinus rhythm except for the rate. Rate: atrial and ventricular rates are between 100 and 150 beats per minute. Rhythm: atrial and ventricular rhythms are regular. P waves: uniform in appearance and followed by a QRS. PR interval: 0.12 to 0.20 seconds. QRS: 0.04 to 0.10 seconds. With the increased rate and rapid depolarization, you might lose a T wave, in which case you would have a P, then a QRS, then another P wave. You must identify the P waves and march them out. Just as the slowing of the heart rate is not necessarily a cause for alarm, the speeding up of the sinus rhythm, even to the point of being sinus tachycardia, may be just a normal response to a variety of factors including exercise, pain, stress, anxiety, fear, or other strong emotions. Sinus tachycardia can also occur when the body's demand for oxygen increases because of infections, fever, hypoxia, shock, dehydration, congestive heart failure, or MI. There are many prescribed drugs, including atropine, dopamine, dobutamine, and epinephrine, that can cause sinus tachycardia, and there are even more chemicals taken unwisely or illegally that can cause real problems for a patient's sinus rhythm. These include alcohol, caffeine, and a whole variety of illicit drugs. While their effects will eventually wear off, the impact on the heart can be dangerous or even fatal. In determining if or how to treat a patient with sinus tachycardia, be sure to first carefully assess the condition of the patient and then make a plan to treat the underlying cause of the symptoms they are exhibiting. For example, if the patient is in pain, relieve the pain. If they are dehydrated, immediately replace fluids, and so on. After those symptoms are taken care of, you can concentrate on the source of the problem.